All right, so this is your foot palpation. We're gonna do the bony structures first. And I think what will help you is if you start on the toes and you work up towards the tarsal bones up here towards the ankle. Okay, so let's start on the great toe. And when you do this on your practical exam, this is what I want you to do. So this is your first distal phalange, and this is your interphalangeal joint. Okay, I can feel a little bump in there where it's the end of one bone and the start of the other bone. So this is your IP joint right here, interphalangeal, and this is your proximal phalange of the great toe. This is your first metatarsal phalangeal joint, or MTP joint, and then the first metatarsal is right here, okay? So this gets us right into this concept of long bones are nice and smooth in the middle, but they have bumps at the end. So there's a bump right here, and there's a bump right here, okay? When you cross that bump, Megan, this is kind of what you were asking, then you're on the cuneiform, okay? So there's the first cuneiform right there. The navicular's over here, but for now, you can use that, well, here's the first metatarsal, here's the base of it, here's the first cuneiform. You can use that to keep yourself organized, because it is difficult to tell where the end of the metatarsal is and where that cuneiform is. Okay, so second distal phalange. This is our distal interphalangeal joint right here, the middle phalange, and then the proximal interphalangeal joint here. And this would be the proximal phalange and the second MTP joint. So then, if this is the joint right here, then this is the second metatarsal, okay? And I can feel it gets a little bit rough and bumpy feeling right here, so that's the end, and there's the second cuneiform, okay? So third distal phalange, DIP joint, middle phalange, proximal interphalangeal joint, proximal phalange, third metatarsal phalangeal joint, MTP, and here's your third metatarsal, okay? You follow that, which articulates with what? The third cuneiform, exactly, okay? So fourth distal phalange, DIP joint, proximal phalange, PIP joint, and the proximal phalange is here, and the fourth MTP joint is right here. So your fourth metatarsal goes onto the side of your foot a little bit like this, and it articulates with the cuboid. Excellent, Nikki. All right. Now, this gets interesting because there really are three phalanges in this tiny little toe. So the distal one is here. Here's your DIP, middle phalange, proximal interphalangeal joint, proximal phalange, and here's the fifth MP joint, okay, or MTP joint. And there's your fifth metatarsal. By the way, it's easier to palpate if you just go on the lateral border of the foot. And this is the base of the fifth metatarsal right here. So which tarsal bone does the fifth metatarsal articulate with?
Cuboid.
The cuboid. Okay, so the last two articulate with this cuboid bone right here. So the base of the fifth sticks out on the side of your foot. That's again going to be a landmark for us when we're taping. And the cuboid is right behind that, like right in this little divot right here, okay? And it's a big bone, so it's all up here as well. All right, now, looking at the lateral aspect of the foot, since everybody's on the lateral side, here's my lateral malleolus, and the shaft of the fibula is right here, okay? And then if you would, Kelsey, just walk around to the medial side, and you guys can shift too if you want. Ooh, you know what? We did that wrong. We all stay. Kelsey, come back. Let's switch feet. Okay, so this would be better right here. On the medial side then, so far we've palpated the cuboid and the cuneiforms. On the navicular bone, right, so follow, and if you see me, I'm on the lateral aspect. Here's the first metatarsal, and here is so we have the first cuneiforms up here, but here's the navicular bone over here. And on the navicular bone, there's a navicular tubercle. My finger is resting on it right now. For some folks, the navicular tubercle is going to be more prominent, but what you notice about Jarrett is he has kind of a high arch, and that navicular, because it's involved in this concept of pronation, and the high arch is not so much associated with pronation, so I'm not surprised that his navicular tube doesn't stick out very far. But on somebody who pronates a lot, you may find a very prominent navicular tubercle. Okay. On the medial side also then, here's the medial malleolus right here. Okay. Underneath your medial malleolus, okay, here's your talus right here, okay, here's the calcaneus right here, and right in this spot here is the subsentaculum tali. There's two S terms that students tend to get confused. The sustentaculum tali is a bony prominence on the calcaneus that supports the talus, which is right here. So this is a bony knot. It feels a lot it feels about the same shape as the navicular tube does over here. So sustentaculum tali is a part of the calcaneus that supports the talus. Okay, so you have your malleolus here. Then here's your calcaneus, and on the calcaneus you have a dome of the calcaneus back here, and that's the part at which the Achilles tendon attaches. Okay, on the bottom of the foot, move back a little bit so we can get the camera in a little. Interestingly, on the bottom of the foot, on your heel, you have a fat pad. And that's why when I'm trying to touch the calcaneus right now, the actual bone, I can't really push in very far because there's a fat pad sitting right there. But you can recall from looking at your skeleton that there's a medial tubercle of the calcaneus and there's a lateral tubercle of the calcaneus. So this medial side is an important attachment point for the plantar fascia. So you're going to put your, and if you want to find it by like if you want to know for sure that you're on it, run your thumb over this plantar fascia right here until you get up onto the calcaneus, and it's going to be right there. Okay. Be careful palpating that for two reasons. One, you have to dig to get there, and that could be painful for your patient. But two, if they have plantar fasciitis, they may also have a bone spur right there, which is where the bone, they get sort of scar tissue or bony formation on top of that calcaneus or calcaneal tubercle. So it could be a place that's very point tender on your patient. Also on the bottom of the foot, then you can come up to the metatarsal head. So the met heads are a landmark that you need to palpate on the foot, and they do exist on the top of the foot. Okay, the metatarsal heads are right here. But because they form the metatarsal arch, they're more clinically important to palpate on the plantar surface. So here is your metatarsal head, and there are your sesamoid bones, okay, on the first, and then we have the metatarsal head of the second, and the third. I'm using an awkward position so the camera can catch this, and the fourth and the fifth right here. Okay, remember on the fifth metatarsal head you may also have sesamoid bones. I don't feel them on Jared's foot. Okay, here's the sesamoids over here. So metatarsal heads, sesamoids, medial and lateral, calcaneal tubercle. Okay, then we do need to switch around to the lateral side, so I'll switch feet again. Don't do this on your patient. We're only doing this to accommodate our videographer. On the medial side over here on the calcaneus, what I want to point out. So the calcaneus wraps around like this. Okay, so it's all under in this area. And what you have just under, so look, I'm inferior to the lateral malleolus and slightly posterior. There's going to be the perineal tubercle. Okay, so remember that we have tubercles and bumps on our bones always for a reason. So the perineal muscles attach up here on the fibula, and the common tendon comes around like this, and it's caused so much friction on the calcaneus over many, many years, many thousands of years, that there's a bump right there to sort of help that perineal tubercle to stay where it's supposed to be. Okay, so there's a landmark down there. This one isn't truly a bony landmark, but we'll talk about it right here. Remember I said there's two S words that students have trouble like remembering which one is which. Okay, so what was it on the medial side?
Sustentaculum tali.
Sustentaculum tali. And so on this side right here, we have this kind of a divot or a space called the sinus tarsi. Okay, so the sinus tarsi is right here. The reason that that's important to us is that if your patient has an inversion ankle sprain, a lot of time the swelling will settle right in that area because the ATF is right up here. Okay, so those are your bony landmarks. We have, the only one I maybe didn't mention was that, of course, the lateral, or the medial malleolus is the distalmost portion of your tibia, so we didn't palpate the tibia at all. That's about it. Go ahead and turn that off.